Well, I mean, you know, you follow a lot of celebrity news over there at K102. So we know whenever a celebrity makes a plastic surgery mistake, we're going to hear about it. So you know, this is tough. Like Melanie Griffith, I mean, these are women who tend to look a little bit overdone. Am I right here, Amy?
Right. And women who looked great.
I know.
You know,
it's tough.
And it's one thing to do a little something, but sometimes they go, well, I have the problem is having too much money.
Yes.
And then they go, I want to do all of this. And it's like, you look bad.
We got to have a little bit of restraint. So a Wyzetta plastic surgeon says a facelift does not have to change the way you look, but it'll leave people asking how your skin looks so good. That's what we want, right?
Absolutely.
TCL's Kelly Hansen headed to Bashioum Cosmetic Surgery Center to find out how plastic surgery plus something called fat grafting can create.
Wait till you find out what this is all about.
It's a very natural look. Take a look.
61-year-old Lindsay Bashioum is headed into the operating room to make a change. It's a place that she's familiar with, but not for the reason you'd think.
I'm actually armed with more information than just other patients because I've seen the procedure, I filmed the procedure, but it's different when it's your own self doing it.
Lindsay is the wife of plastic surgeon Dr. Ralph Bashioum, but she's also a documentary filmmaker and moonlights filming and editing surgery for The Office blog. Now she's going in front of the camera.
So I'm having a lower facelift. So just kind of pulling this up a little bit and then fat grafting under here.
We make the incision right by the sideburn now.
Dr. Ralph Bashioum says traditionally scarring for this kind of surgery would be in the hair, which she says could create more of an aged look.
We want to make the incision so that the hairs grow out through the incision so that once everything heals, the scars camouflage nicely.
It's a simplified technique that Dr. Bashioum says will only take a few hours in the operating room. Along with the lift, Dr. Bashioum is going to rejuvenate Lindsay's under eye.
And then the area we're trying to fill in with the fat transfer is going to be the lower eyelids.
It's called fat grafting. Dr. Bashioum will take fat from Lindsay's stomach and inject where the fat is sagged off the bone under her eye.
So it's your natural fat. Who doesn't have a little extra fat here or there and move it around someplace else?
And I think that compared to man-made materials, this is a far better choice because it can be permanent and it's safe. There's no risk. They don't have the risk of biofilm infections around a product or anything like that. So I really think it's going to change the way we do many kinds of surgery.
Oh my gosh, we're already talking. Look, we can't help it because there's so many questions. Okay, so here's Lindsay, here's Dr. Bashioum. So nice to have you guys here. Thank you so much.
You look stunning.
Look,
you look stunning before, but you would never know.
I know.
Thank you.
Okay, so tell us what you were just telling us about your kids. They live in LA and they were like, Mom, I want you to still look like our mom.
Right, exactly, because that's an extreme aesthetic that people are kind of gravitating to there.
Yeah.
And Ralph is more of a naturalist, I guess. Would you say
In the best way.
Yeah. So you thought about that. I mean, I obviously you think about this with your wife, but you think about this with all of your patients. You still want your patients to look like the person that they are, right?
Absolutely, and one of the key things about buying or hiring a plastic surgeon or an aesthetic surgeon is the aesthetic that they bring with them.
Yeah.
And not everybody has the same idea of beauty. And that's a real thing. So you have to look at those before and after pictures to get an idea of what their aesthetic is.
Well, listen, you have a great idea of beauty because you have a stunning wife. A stunning wife. Okay, so let's look at some of these pictures. So we have a picture of you 3 days after surgery because we're going to get into the little nitty-gritty about what the recovery is like. And then here you are 16 days after the facelift and fat grafting. Look at that. And then, of course, we can see you here today. And so tell us about the recovery. What was this process like?
Well, originally Ralph said, you know, when you go through the whole process of explaining the surgery, about 6 months is the final healing process.
Yeah.
And of course, in my mind, I'm thinking, oh, 6 days. The expectations of just kind of, you know, snapping back real quick are not realistic. So I've been keeping a video diary. So just kind of day by day, the process of healing and all the different feelings you go through. About day 2, you just think, oh, why did I do this?
Yeah.
And then by day 3, as you could see, I was looking, you know, pretty good. The swelling had started to go down. And then after day 3, I think it really goes pretty quickly as far as the resolution of the swelling and the tingling and all that sort of stuff.
For such a big procedure, that's not a lot of time.
I know, and I had no pain. It was
Wow.
crazy.
That
I
was
just
my
took
next question.
extra strength Tylenol. That was it.
Oh my gosh. Well, New Reflections did your hair and your makeup today, which looks stunning. You look so beautiful. Dr. Bashioum, can you talk about the idea of, doing this procedure on your wife? Because a lot of people are probably thinking, wow, I wonder if he was nervous to do this.
Well, we're nervous every time we do surgery.
Yeah.
But on your family members, they're relaxed and you can be more relaxed. I had my partner, Dr. Mogadam, with me, so it was a safe kind of environment for Lindsay and for all of us. So it worked out really well.
And I wanted to go to the best.
Oh, yes. Hello.
Well, absolutely, you could have gone anywhere. Can you tell us about taking the fat, and you think that would be injected just through the skin, but you did it a different way.
Whenever we do the fat transfer, that's to naturally enhance the face. In fact, my partner just did a breast reconstruction on a woman just last week, so it's a very exciting kind of change for all of us. But what you do is we injected it through the facelift incision, so you're able to access the areas you wanted to put the fat through those incisions. Now, women who are not having a facelift or men who are not having a facelift, they're going to have this. There are small, very inconspicuous hidden incisions we can put this through. You can inject it just like any kind of material.
Okay, this is amazing. So, Lindsay, let's take a look again. Let's look at the before picture. Let's look at you before.
Oh my gosh.
Well-
That's why I looked in the mirror and just, my inside didn't match the outside. And I said, today, okay, I need to do this.
I got to tell you, this is amazing. You look wonderful.
Because I
glowing.
didn't feel like the
Yeah.
older lady that was.
And that's the biggest thing. The
Yeah.
inside matching the outside, I think, is so wonderful. Thanks for being here. Thanks for sharing your story. So you can call Bashioum Cosmetic Surgery Center to schedule your consultation today. And if you have any medical concerns, as always, you consult your primary physician first. But we've posted more information at TwinCitiesLive.com. We want to thank Bashioum Cosmetic Surgery Center for sponsoring Twin Cities Live. And you've got the video and the blogs and everything up on the website, right? Can we see it?
Not yet.
Not yet? We'll
I'm
get it
working.
up. Okay,
Yeah.
good. We got more TCL to come. We'll be right back. I think I just gave you a task. Sorry.
Now get to it.